Hello guys, welcome to Rebuild Academy. My name is Adil Moni and I welcome you to the 8th part of our series From Virus to Vaccine, Let's Fight Infodemic. I hope you all are doing well, fighting pandemic as well as infodemic. But before we begin, let me tell you a very important point. It is extremely important and highly recommended to watch this series in order. Only then you will get a complete idea and a clear picture of every concept involved. The link is given in the description. Now, let's begin. In the previous discussion, we discussed in detail coronavirus, especially SARS-CoV-2 and its variants and COVID-19, including the viral replication cycle, and we also look into pneumonia and its complications. Today, we will discuss the medical diagnosis, different methods of medical diagnosis, and later we will look into the most important tests that are currently used for diagnosis of COVID-19, that is RT-PCR test and rapid antigen test, the working principle of these tests, and we will also look into rapid antibody test and how it is different. Okay then, let's begin. Medical diagnosis is the determination of disease through the symptoms of the patient. Broadly, there are two parts of medical diagnosis: clinical diagnosis and laboratory diagnosis. Clinical diagnosis involves a physical examination and medical history of patient. Based on the symptoms of the patient, the doctor will examine the concerned area of the body and will ask questions regarding the previous medical conditions. By doing this, doctor will get a preliminary idea regarding the disease and its cause. If the doctor is confident about the disease, he can directly provide the required medical treatment. If he is not confident, then the disease can be confirmed with an appropriate laboratory test. Laboratory diagnosis involves different tests. Basically, there are two categories of tests involved in medical diagnosis: molecular test and imaging test. A molecular test is a set of laboratory tests that checks for certain genes, proteins, or other molecules in a sample of tissue, blood, or other body fluid. For example, a WBC test is a blood test on which the number of WBCs are measured in the blood. Molecular tests are used for the confirmation of disease. An imaging test is a way to let doctors see what's going on inside your body. These tests send form of energy like X-rays, sound waves, radioactive particles, or magnetic field through your body. Your body tissues change the energy patterns to make an image or picture. X-rays and CT scans are commonly used imaging tests. X-ray tests produce two-dimensional images, whereas CT scan produces three-dimensional images, thus giving more insight. While X-ray tests are primarily used for imaging bones and heart tissues and are not effective for imaging of organs and tissues, therefore CT scans are used for this purpose. So, imaging tests are used to find the severity of the disease. For example, we do X-rays to find the nature and location of fractures in the bones. Now, before discussing COVID diagnosis and different tests involved, let me discuss a couple of points here. First, let us find out who should get tested. There are two scenarios in which it is advised to get tested. First, when you experience the symptoms of COVID-19, and second, when you have exposed to the virus. As you get in contact with someone who later tested positive for COVID, or even you have attended a large gathering, then you should get yourself tested because it is possible you are asymptomatic and spreading the virus. Another point is, most people are confused between screening tests and diagnostic tests. They are not the same. A screening test is done to detect potentially infected people who do not have any symptoms of the disease. Screening tests do not confirm the presence of disease in the person. The goal is early detection and surveillance. To isolate such people, thus reducing the chances of rapid virus spread among the people. The screening test can involve asking series of questions regarding any specific symptoms or travel history of the patient. Also, body temperature measurement and oxygen level measurement are screening tests. The normal body temperature of human is 37 degrees Celsius and oxygen level should be in the range of 95 to 100 and it should not fall below 95. If it falls below 95, then it is recommended to seek medical help. Now talking about molecular tests used in the diagnosis of COVID, then they can be classified based on a diagnosis of current infection and diagnosis of past infection. Rapid antigen tests and RT-PCR tests detect whether a person is currently infected with a virus or not. A positive result implies the person is currently infected and a negative result implies a person is not currently infected, but it does not tell about the past infections. On the other hand, a rapid antibody test is used to determine if the person had any infection in the past, but it does not tell about the status of current infection. Now let's talk about RT-PCR test. The full form of RT-PCR is reverse transcription polymerase chain reaction. You have learned about transcription in the previous discussion. It is a process by which the RNA is made from DNA and it contains the instructions for protein synthesis. The reverse transcription is the opposite of that. That is, DNA is made from RNA. You can consider this as retrieving the DNA file from the RNA pen drive, right? On the other hand, the polymerase chain reaction is a process in which a large number of sample DNA is rapidly made. For example, if you have a single DNA, then by using a polymerase chain reaction, you can make a huge number of copies of that DNA in a short time. Like you can copy and paste DNA files and make a large number of the same file. Now let's look into process of RT-PCR test. In the first step, the nasal secretions is collected from the nasopharynx, which is the upper part of pharynx. This can be done through the nose or mouth. The stick used for this collection is called as nasopharyngeal swab. It is made up of cotton or nylon. This swab with secretions is then stored in a preservative, after which virus genetic material is isolated by extraction and purification processes. Then the RNA is converted into DNA through reverse transcription and thus obtained DNA sample is rapidly multiplied using a polymerase chain reaction, after which this DNA is compared with virus DNA with the help of special equipments. If the DNA matches, then the result is positive, otherwise negative. RT-PCR test is currently considered the gold standard of testing COVID. It has high sensitivity, but the time required to complete a test can be from 4 to 8 hours, and also it is a comparatively costly test. Now let's discuss the rapid antigen test. The strip used for the rapid antigen test looks like this. There are two lines, C or control line and T or test line. This looks similar to the pregnancy test strip. Now let's look inside the strip. There is a special paper strip on which two layers of antibodies are placed. The first layer is of antibodies for antigens present in SARS-CoV-2 and other layer of antibodies are control antibodies that are used to confirm the validity of the test. Now let's see the testing method. First, the nasal secretions are collected with the help of a swab and placed in an extraction buffer tube. The swab is stirred multiple times to transfer it to the buffer solution. Then, this buffer solution containing the antigen is dropped into the specimen well. The specimen well already contains the antigen for which we have placed the control antibodies, and when we add our solution in it, these all antigens start traveling along the length of the strip. If the already present antigen reaches the control antibodies, then the control line appears on the strip, which confirms the validity of the test. If the control line doesn't appear, then the test is declared invalid. Now, if the solution dropped contains the antigens for which we have placed antibodies on the strip, then they will catch them and a test line will appear on the strip, confirming the positive result. It is important to note that if both control and test line appears, it implies a positive result, and if only the control line appears, then it implies a negative result. If the control line doesn't appear, irrespective of the test line, the result is invalid. The advantage of rapid antigen test is it is rapid. It takes 15 to 30 minutes to complete the test, and also it is comparatively cheap, but the sensitivity of the test is low. Therefore, there are chances of false negative. That is, the test can give results as negative even if you are positive. Therefore, it is good practice to do an RT-PCR test for those who show symptoms and still show negative and rapid antigen test to confirm the status. These tests are also available in many countries in the form of home testing kits, so you can use them to test yourself if you have any symptoms. Now, lastly, let's discuss rapid antibody test. This test is used to determine if the person was previously infected with the virus. In the case of rapid antibody test, blood is used for testing instead of nasal secretions. It is logical because we are testing the presence of antibodies that are found in blood and not antigens that are found at the site of infection, right? Now, the strip of rapid antibody test looks like this. It has three lines, namely control line, G line, and M line. The mechanism here is opposite to that of the rapid antigen test. Here we place antigens on the strip instead of antibodies. Human bodies produced IgG antibodies primarily as innate immune response and IgM antibodies as adaptive immune response. So, if your rapid antibody test shows control line and G line, then it implies you had an infection and it's not a recent one. But if it shows control and M line, then it indicates the recent infection, and if all the three lines appear, then you have both the antibodies. Also, if the control line doesn't appear, irrespective of other lines, the test is declared invalid. The rapid antibody test is also called a serological test. Serology is a study of serum, which is a liquid component of blood. Therefore, a serological test is used to check the presence of antibodies in the serum. These tests are used for conducting serosurvey. A serosurvey is a survey in which few random persons are tested with a serological test to determine how many of them have developed antibodies against the virus. Serosurvey estimate as well as monitor infection trends in the population, which is specifically location-based to understand the current course of the virus. Health experts dealing with COVID-19 believe that nationwide coronavirus serological survey will be beneficial as it will help in bringing out the exact viral load and thus help in building up strategies. So this brings us to the end of today's discussion. Now, as usual, let's quickly revise the topics we discussed today. We started today with the topic of medical diagnosis. We learned about molecular test and imaging test. Then we talked about who should get tested for COVID. After which, we distinguished between screening tests and diagnostic tests. Then we discussed the molecular test to detect current infection and past infection. We have briefly gone through the RT-PCR test. We also learn about rapid antigen test and their small comparison with RT-PCR test. And in the end, we discussed the rapid antibody test, which is a serological test, and it is used in serosurvey, which is crucial for detecting virus prevalence in the population. In the upcoming video, we will be discussing crucial concepts like immunization and vaccine making. So make sure to subscribe the channel and press the bell icon for timely notifications. If you enjoyed and learned something from this video, then ensure that you like the video and share it with others so that we all work together and battle the infodemic. If you have any suggestion, you can comment below. That's all for now. We will meet in the next video. Stay safe, stay connected.